capacity and the doors have been closed, we might as well start this meeting. It'll give us a little bit more time to have a discussion. I'd like to welcome you all to Wauwatosa, and I want to publicly thank the Wauwatosa Public Library for its cooperation in setting up this meeting, and also local law enforcement officials for their service this evening. I appreciate the opportunity to hear your concerns. In fact, this is the 81st public meeting I've held since January. You probably know that some of these meetings have become very contentious. So I want to be sure to review the rules that we need to adhere to so that we can have an orderly environment in which to exchange ideas. First, I ask you all to sign in with my staff. If you would like an opportunity to speak, you need to check the speaking box that appears in the sign-on slips. That way I'll know to call on you during the first part of this meeting. I will be giving priority to those of you who reside in Wauwatosa, and then if time permits, I will continue to call on residents of the 5th Congressional District. If additional time is available, I will call on those who do not reside in the 5th District. This portion of the meeting will last about an hour and 20 minutes. I expect participants to be respectful and to allow the person who is recognized and has the floor the opportunity to speak without interruptions, as well as when I respond to each comment. Further, if the question you would like to ask or the comment that you would like to make has already been made, please refrain from asking it again. We should try to hear from as many of you as we can within the time constraints. If at any time participants become rude or disruptive, I will immediately adjourn the meeting, as there is nothing positive to be gained from continuing with a meeting which is disorderly. We can all disagree without being disagreeable. Signs are okay in this room as long as they are not either disruptive or obstructive. The second part of the meeting is devoted to those of you who seek my help with personal problems they are experiencing with the federal government. The way I know you would like to speak to me privately about these matters is if you indicate that on the very bottom of the sign-in slip. This part of the meeting is an opportunity for us to have one-on-one private conversation, and it is not the time to continue discussions from the general part of the meeting. Any filming or recording is prohibited during this part of the meeting. And the reason for that is a lot of this has to do with VA medical stuff, and that's private, and nobody should have that up on the internet that is to be used against them. So without any further ado, let me call up first in this meeting is Eugene Barufkin of West Wells Street in Tosa.
Yeah.
Okay.
Thank you. I guess I was privileged, I could say, at a town hall meeting where you announced you were just became 65 or were becoming 65.
That was a while ago.
And you were going to be getting Social Security and Medicare. I'd like to know about your experience with Medicare and why you would think it would be bad for everybody to have Medicare. It seems to me that if we started expanding Medicare to like age 50, it would sure help a lot of people. We would not worry about the counties that don't have private policies available under ACA. As a former small business owner, I would have loved to have my employees 50 and over on Medicare because it would have lowered the insurance premiums and the coverage would have been better. So I'd like to know from you if you were experiencing any problems with Medicare, number one, and number two, why you don't think it would be good for everybody.
First of all, I'm not experiencing any problems on Medicare because I'm not on Medicare. I'm on Obamacare, which is required of all members of the Congress and congressional staff. My Obamacare policy stinks, and the reason it does is I have an $800 a month premium and a $15,000 deductible. That means that I have to spend about $15,000 out of pocket before the insurance pays a dime. Now, I can afford it, but most people can't. And that's one of the reasons why we need to repeal and replace Obamacare. Now, whether or not we should expand Social Security or Medicare, I think, is another question. And the question is whether the Medicare system can afford that. The answer to that question, very clearly to my mind, is no. Medicare A is a closed-end fund. It is financed by a part of the Social Security payroll tax. Medicare B is funded out of general revenues, more or less like a welfare program is. Medicare C, which is Medicare Advantage, is funded about the same way, but private insurance companies operate it. Medicare D, which is prescription drugs, is also financed that way. Now, the projections for Medicare, have been that the Medicare A fund will be going broke sometime within the next decade. By expanding it, it's going to get broke earlier, and then all of a sudden, when it goes broke, then there's not going to be the money to pay the benefits that people have expected. People say raise the payroll tax, that's a job killer. And, we've got an unemployment problem, particularly, with disadvantaged youth. Just look a few miles to the east of here. We ought to be putting people on payroll so that they pay taxes, including the Social Security tax, rather than burdening business owners and the American public with more taxes. Karen Albers, North 107th Street.
I have a question also about the medical things. I'm just not understanding how things all fit together. Under ACA, I understand that some people get onto Medicaid who would not have been on Medicaid before. And with the new plan that the Republicans are proposing, I'm not sure, but is that phased out, or what is the before and after on that?
Well, the answer is no, and in fact, it's augmented. Both the Senate and the House Republican repeal and replace plans, increase the federal expenditure on Medicaid from $380 billion a year to $500 billion a year. That's an increase, by the way, anybody was taught math. And I think that there's been a lot of misrepresentation of what is happening to Medicaid. Now, if Medicaid kept on the way it's going, without any kind of changes and targeting of Medicaid, it would go up, another $150 to $200 billion a year. We've got a debt problem in this country. We've got a $20 trillion national debt. If people will not lend money to the federal government because they think they're never going to get repaid, then the only way these bills get paid is by the Fed running the printing press. And that's going to be inflationary, and inflation is something that particularly hits the middle class and people on fixed incomes, like it did 35 years ago when we had double-digit inflation. And I would say that fortunately the Fed and the Treasury and the Congress and all of the presidents since then, have put a lid on inflation so that it is manageable. We can't afford to have that lid come off, particularly in paying interest on a $20 trillion debt. Because if that goes up by 2 or 3 or 4%, we're going to be spending hundreds of billions of dollars over the period of time, and paying interest on the debt, which doesn't educate anybody, doesn't make any sick person any better, and it's going to further increase the inflationary spiral. Now, the other thing I want to say about not reforming Medicaid, is that if we don't reform Medicaid, we are going to see this country go bankrupt. And I'm saying that, just completely, and people started saying that when Bill Clinton was the President of the United States. He said that too, good Democrat that he is. And I have a problem on whether it's good economics or the right thing to do to borrow money, to spend money on ourselves, and then send the bill with interest to our children and grandchildren. That's bad economics. It's bad politics. It only weakens the fabric of the United States of America. And I would submit to you that it probably is not moral to spend money on ourselves and let our children and grandchildren end up paying for it. Amy White of Blanchard Street, Tosa.
Hello. Hi, this is Sensenbrenner. I'll try to speak up. Thank you for holding these town hall meetings. I appreciate it. I've come to many over the last few months, and this is my first opportunity to say something, so I appreciate it. I first met you about 20 years ago. I went to Lawrence University, and I think that's your wife's alma mater. And I received a scholarship my senior year, and so I really appreciated that.
Congratulations.
Thank you. I've been in healthcare, or involved in healthcare, both personally and professionally for a long time. So when I was at Lawrence, my mother had brain cancer, my father had lung cancer, and I was first power of attorney for one and then guardian over the other, and they both passed away during that time. And I went into medical genetics after getting a master's degree at UW-Madison. I know you also support higher ed throughout the state, and I appreciate that as well. So I had the fortunate chance to work in healthcare after getting my degree here at Children's Hospital of Wisconsin. I worked in healthcare for 12 and a half years with children and adults with genetic disorders. And that really gave me great experience in seeing how it works, like boots on the ground in the hospital. Working with all of those children and adults, you see that, of course, rare disease isn't well covered. It's difficult to deal with orphan diseases. The treatments are expensive. But I was there when the Affordable Care Act provisions went into effect. And I saw the difference it made. Parents didn't have to take out a second mortgage on their homes for their kids to continue to get treatment. Previously, I worked with adults with genetic disorders who had to get health insurance through the high-risk pool. And I've heard people at some of your town halls say that it worked for them, but it didn't work well for the majority of individuals. It would take 2 years to appeal. If they got coverage, it was for treatment only, and it was not covering the actual lab tests or physician visits. So basically, it would be treating people in a vacuum with blinders on, not able to adjust treatment, just trying to keep them alive. And after the Affordable Care Act, they could enter the exchanges, and actually costs went down because they could be managed appropriately. So it was amazing to see these kids with problems become adults, continue to have their insurance, continue to have treatment. Parents could actually switch jobs because their insurance wasn't tied to their current place of employment, and oftentimes they did better because they could finally switch where they were employed. So there were all these wonderful benefits that I saw, and I also wanted to comment that the high-risk pool wasn't so great. I have concerns about this new healthcare provision, and I bring up all this history because I know that you're a disability rights advocate, and you've done many things, but my concern is that this healthcare plan does so much more to hurt disabled individuals than the legislation that you've supported and that's been put in place based on how coverage is. So everyone with a genetic disorder has a pre-existing condition. They're born with it. There's no way for them to go back on that, to fix it. You can't cure a genetic disease. And we all have some mutations, some predispositions to disease, right? 1 in 3 people get cancer. Cancer is a genetic disorder. So I'm concerned that this has been supported, but also want to say that I know that you know how much these things cost. I know that your wife has similar healthcare issues to what my mother with brain cancer went through. She was in an assisted facility and had 24-hour care for 4 years. And you know that that's supplemented with Medicaid. I wouldn't have been able to finish college to support her, to take care of her. She wouldn't have lived as long or done as well without that support. So I put all of that out there to say that I appreciate that you listen to all of us to whatever extent, and that you do have constituents that are involved in healthcare, and I want you to keep working.
Let me respond this way. Your experience with Obamacare was before the Independent Payment Advisory Board became effective. It never has become effective to date on that. There's some that refer to the IPAB as the death panels. Now, what the IPAB is supposed to do is to look. Is supposed to look at how much a treatment costs, what the possibilities are of the person being restored to health so that they can work after their disease had been successfully treated, life expectancies, and a whole lot of other issues. Now, if the IPAB says it isn't worth it to spend money under the ACA for that type of a patient, then they will prohibit any more payments to that type of patient, and the patient can go off and get their own doctor, you know, at the sticker price rather than the discounted price, which very few people can afford. So, you know, in effect, an IPAB decision against that is essentially a death warrant, because if they aren't able to afford the treatment, they're going to pass away. We should not have a government-controlled bureaucracy making decisions like this, period. No exceptions. Now, the Republican health care plan gets rid of the IPABs on that. And what it does is two things. One, it sets up a high-risk pool, which will have an over $100 billion federal subsidy. And the reason that this is necessary is that if you have all of the high-risk people and the low and medium-risk people, it raises the premiums on the low and medium-risk people, that people will decide to not go with health insurance and, you know, just run the risk that they don't get sick or wrap their motorcycle around a tree and have a, you know, a very serious injury as a result of that. So the high-risk pool will have the subsidy in it. The subsidies will increase based upon the age of the people who are enrolled in the high-risk pool, and this will make the premiums lower for the lower and medium-risk people, which is important, because if you look at what Obamacare has done, and it's just almost the opposite of what I've just described. The Obamacare premiums in Wisconsin have increased 97% since Obamacare started, almost doubling, and that does not include the announcement of what next year's premiums would be. So they're talking about a double-digit increase on that, but we don't know how much. Furthermore, there were 115,000 Wisconsin tax filers that paid the fine to the IRS because they didn't have health insurance. Now, why didn't they get health insurance? Because they thought that what was being offered to them was too expensive. So, you know, having a high-risk pool and channeling the government subsidy to people who are high risk, and remember, all of these bills prohibit denial of coverage because of a pre-existing condition on that. You know, we will be able to... oh, you disagree with prohibiting coverage because of pre-existing conditions? You're in the minority. So, you know, what I can say is that you know, with a pre-existing condition ban and also no limitations in any of these plans on either annual or lifetime caps on that, you know, that will increase the cost for everybody, because as you said, we all have pre-existing conditions. But to figure out the way to get the people that are most expensive to treat in a separate pool and aiming the government subsidy at that will allow lower premium rates for the low and medium risk patients, and maybe we can get more people to sign up for health insurance. At least that's what the hope is, and that's what the thinking is behind that.
And so the fact that what was promised to the insurance companies that entered the exchange was only funded to 12% of what was supposed to be, so, you know, basically the funding didn't come through in what the original Affordable Care Act.
Okay, remember what I said about interruptions, number one, on that. You know what I can say about that is that there was a lawsuit and an injunction against it. And that's a court order. A court order has to be obeyed, and the issue is on appeal to the U.S. Supreme Court.
And one last question. I've called about this several times. Do you believe that Russia's interfered with the election process at the end of 2016?
Well, you know, the answer is back to Soviet days. You know, the Russians, you know, have been meddling around not only in our elections, but in the elections practically every place in the world. And that hasn't changed, you know, up to the present day. I guess what gets under my skin is the fact that President Obama knew about this in August.
Yes, he did.
Right? So he knew about it in August by his own omission and didn't talk about it until November. And why there was the delay between the time Obama talked about it before the election And after the election, when Trump had been elected, only President Obama can answer that question. We all can speculate on why he did that, but I'm not going to speculate in public.
So you support the sanctions that he put in place with Russia and Iran?
Oh, I support increasing the sanctions. You know, I'm no fan of Vladimir Putin. He's the world's biggest bully, and you know the only way you stand up against the only way you stand up against bullies, you know, is by being very firm and getting them where it hurts. And the Russian economy is a house of cards. You know, it's based on almost exclusively on oil, and the price of oil has gone down by more than a half since it peaked. And Vladimir is in a world of hurt because he isn't getting the oil revenue that he thought he would get.
Right, and so does it concern you at all when you see these ties and when you see our president kind of being soft or wanting to get rid of sanctions? We'll find that out when they meet shortly, but.
Well, I haven't heard that. And Secretary of State Tillerson was talking about increasing the sanctions on Russia, which I support. The tighter we can, you know, turn the screws on Putin, you know, the better we'll be able to be, particularly in terms of reaching some kind of a deal, you know, to end the slaughter in Syria, because Russia is, you know, now an important player because there was a vacuum that was caused during the last administration. Jesse Sundlove, 66th Street, Tosa.
Hi, nice to meet you. My wife and I just moved here less than a year ago, and I'd like to say that the people we've met in Wauwatosa have been some of the friendliest, kindest people.
So much for friendly.
Let me say, I agree with you. They are very
Some of the friendliest people of any town I've ever been to. Now, having said that, I'm not from Wauwatosa. So the New England Journal of Medicine a couple years ago released a study that analyzed the correlation between losing health insurance and mortality rates. And extrapolating from that information, it's been stated that up between 25,000 and 40,000 people a year are going to die from the bill that you voted for. I wanted to know if you feel like you have blood on your hands.
No, I don't. Okay, number 4. I'm counting them now. What I can say is that Obamacare is on a death spiral. There are companies that are pulling out of the exchanges. The premiums are going up, and as the exchanges collapse, there will be more and more people who will be losing their health care because the exchanges have collapsed. Now, Republicans are doing something to try to fix it. This is a very complicated issue. Can I ask you, do you want this meeting to continue or not? Because I said in the beginning of the meeting that I would not go along with any kind of interruptions, either of the speaker or of my responses. You can agree with me or disagree with me, but we do not in this country decide issues based upon who can yell the loudest. And we can disagree without being disagreeable. Our country was based on compromise. That's why all the checks and balances were put in the Constitution. It was designed to prevent anybody from being too powerful. But I think that what we need to do here in this country, and it's not just in Tosa or Wisconsin, but all over the country, is to start being a little bit more respectful of opposing views. Because what's going on now is toxic. You know, we have seen people who have gotten so angry by listening to cable TV and looking at the internet that there was an assassination attempt on the Republican baseball team in Alexandria, Virginia 3 weeks ago. And that is something that cannot be tolerated anywhere in the world in a civilized country. All you need to do is to look at what the gunman who was killed by police had put up on his Facebook post, you know, the fact that, you know, he had been picketing, he had been repeating a lot of things that had gotten him to such a swivet that he went to violence. So the time has come in this country for the sake of our children and grandchildren, that we cool it. Donald Trump is the President of the United States for the next 3.5 years. I think that, well, whether you voted for him or didn't, he's the President of the United States for the next 3.5 years. And what we do when we disagree with public officials is wait for the next election. And I would encourage all of you to do that, whether it's for me next year or for Mr. Trump in 2020. Now, to get back to your question, no, I do not have blood on my hands. What I can say is that you're seeing people reject Obamacare, by those who are actually paying the fine to the IRS rather than getting health insurance. The thing is, the Republican bill has guaranteed insurability in it for everybody. That means that regardless of whether or not there's a government mandate, which is being ignored by at least 115,000 people, in this state, they will have health insurance available to them. And because of what I said earlier relative to high-risk pools lowering the rate for low and medium-risk people, I think that the health insurance will be more affordable for everybody. Getting back to my Obamacare policy, as a member of Congress, where we're forced by law to go into this, it's $15,000 more or less out of pocket before I'm able to collect a dime in health insurance. And again, I admit I can afford it, but I don't think many people can afford that kind of a policy, and that's why this has got to be fixed. Okay, is it Dave Barkowski of North 103rd Street in Tosa? I'm sorry about mispronouncing your name. You here?
Oh, that looks like my name.
Okay.
It's Paul.
Oh, okay. Looks like Dave. Okay, go ahead.
It's Paul Paradowski.
Okay.
I guess I really don't have a question for you today. Just to comment what's going on in my mind with Social Security is right now, all we're hearing is Social Security is going to be dead in a decade or two. And so to solve that, we should reduce benefit or reduce Social Security payments to those that are getting it now and those that will be getting it in the future, and increasing age limit even more before getting into Social Security. And I understand that right now Social Security charges, or the taxes, or whatever you want to call it, are capped at about $130,000. Why can't we raise the cap to $500,000 or $750,000? Because I own a number of stocks, and I see the annual reports and everything, and we even vote on payment for the CEO and everything else. And just their basic salary, I haven't seen one that's under $700,000. Why can't we be taxing them all the way up to that $700,000?
Okay, 2 points. Point number one, in the early 1980s under Reagan, the taxes went up, the age went up, the cap went up, and that was, self-employed people, instead of paying 1.5 the employee rate, had to pay 2 times the employee rate. All of this additional money was put into a pot which was designed to be a financial cushion when the baby boom generation retired, because there'd be a lot of people who were born after the end of the Second World War, which would mean a lot of benefits that would be paid out, et cetera, et cetera. That pot of money, according to the Social Security trustees, is supposed to expire somewhere around 2033, plus or minus a couple of years. Now, when that happens, there will still be Social Security, but if there are no changes in the law, and Social Security will work on a current funding basis, meaning no nest egg, and the money that goes in will go out to benefits right away, the Social Security Administration estimates that all the benefits at that time will drop 27%. So, this is just not a matter of anything but demographics. We're all living longer. Some of us are retiring earlier, some of us are not retiring earlier, but the fact is the life expectancy is shot way up. Now, your second point is, why not raise the cap on wages that are taxed or eliminate the cap altogether? When Social Security was first passed during the Roosevelt administration, it was contested in the Supreme Court, and a 5-4 decision said that the amount of benefits one gets had to approximate somehow the amount of taxes that were paid both by the employee and the employer. And if you broke that cap, then the whole issue would end up being relitigated. So if you break the cap, then it'll be relitigated, and I'm not willing to do that because given how Supreme Court decisions come down, that's a risk that I don't think is acceptable. If you raise the cap, then you also raise the amount of Social Security benefits that the top income people will get. Otherwise, you violate that Supreme Court decision. So if Warren Buffett and Bill Gates end up getting 5-figure Social Security checks every month, I think that there would be a lot of legitimate squawking about how much they were getting out of Social Security compared to the rest of the public on that. So, this would end up taking away the almost universal support that Social Security has received. So, that's why, there is a cap, which you're right, is about $130,000 a year. I would say that the Medicare part of the cap, which is Medicare A, the hospitalization part, there is no cap on that because it is a program that is not based on age and actuarial issues, but it is based upon whether somebody who is covered goes to the hospital or not. So, somebody who has a salary of $700,000 or $7 million a year will pay the 1.45% Medicare tax times 2 if they're self-employed. That answer your question?
I guess kind of. I wouldn't actually lump Warren Buffett into that because Warren Buffett doesn't get a salary.
I stand corrected.
So he wouldn't be paying anything to begin with.
Maybe he doesn't get a salary because he's figured out how to avoid the Social Security tax. He is a smart guy, all the money he's made. Michael Savage, West Wright Street.
Hi, good evening. I just have a question with the proposed healthcare health bill. Why are all the major tax cuts put in it for the wealthy? What does that have to do with the healthcare?
Well, I can answer that question. The thing is that what the bill does is it repeals all of the Obamacare taxes on that. And when you've got a little bit less than half of the population not having any federal income tax liability at all, there really is not too many places where you can cut taxes where they make some difference. But it's the Obamacare taxes that were repealed, whether, it was, the tax on not signing up, the tax on the employers not providing health insurance, under the law, and, I could go on and on and on that. So that's why the bill does that, is that these taxes were imposed by Obamacare, and with Obamacare being repealed, the taxes that were used to fund Obamacare would be repealed as well. Judith, is it Bellarmine?
Bellarmine.
West Wales, go ahead.
I'm not sure that this is an appropriate question or for this meeting. I'm saying this on behalf of my child who died from drug addiction last year.
I'm sorry to hear that.
Thank you. I'm concerned about this epidemic and whether there's going to be funding to help people who are suffering from this addiction. I asked Congresswoman Gwen Moore the question, and she said, forget about it.
She's wrong.
She's wrong. Okay.
I am the author with Senator Portman of the Comprehensive Federal Response to Opioid Addiction, which passed with very few dissenting votes and was signed by President Obama, a bipartisan bill that I was the principal author of. The thing is that was an authorization which was comprehensive. It dealt with law enforcement, it dealt with first responders, it dealt with education. that dealt with mental health, you know, the whole gamut on that. Authorization bills are not funded. They authorize how the money is to be spent, but the appropriations bill does fund it. And there was an appropriation I think over $150 million that was passed in the omnibus bill that funded the government through the end of this fiscal year. So it was less than a half a year in that. And one of the things that is being negotiated in the Senate is whether there would be more funding that would be put into the Senate Republican health care bill. But that is an issue I think we'll find out more about when Congress goes back next week. So, you know, the answer is yes, this is an addiction problem. It's out of control. There have been more people killed by opioid addiction in this state than were killed by car crashes last year. And that's kind of an awful statistic. And it's something that I think you're seeing the government at all levels, you know, as well as the private sector, you know, come up with a response, you know, that it's got to be comprehensive in nature. Because there are many facets to, you know, why people end up getting hooked on opioids.
Thank you.
Okay, is it John Rowan, North Wauwatosa Avenue? Go ahead.
Good evening. With regard to the Republican health care bills, what are your thoughts and feelings on the role of health savings accounts and flexible spending accounts?
I'm for health saving and special medical savings accounts. You know, I think that this is a very good way that, you know, people can set aside money for things like co-pays and deductibles, you know, on healthcare policies that they have. It's something that's self-directed. You know, we've had those for, you know, quite a while. The Obamacare law reduced the amount of money you could put into an HSA or an MSA in half. We ought to restore it and then some. And, you know, I think that this is a very good tool where people, you know, could actually have a bigger say in healthcare decisions and how they're paid for than under a plan that's entirely run either by insurance companies or by the government or both. Rachel Nielsen, Hillcrest Drive, Tosa.
Hello, sir. Thanks for coming. I just wanted to say that of all the times I've called your office, your staff has always been very thoughtful and very good listeners, so I appreciate that.
Thank you.
And I appreciate you still continuing to do these town halls even in this time. One thing that you had mentioned earlier is that we needed to calm down the vitriol. We needed to work in a more bipartisan atmosphere and listen to people who have disagreeing opinions with us. What actions should we expect to see from you, sir, that are going to show bipartisanship and working across the aisle?
Look at my record.
No, sir, I
look,
don't
you know,
mean it in a disrespectful way. I'm
Well,
saying
let me
more like
answer
what-
respectfully. Look at my record. The Pew Foundation, you know, rated every senator and representative on who was bipartisan and who was not. There were only two that passed the Pew smell test, Ron Kind of Lacrosse and me. You know, I've worked across the aisle, you know, on a number of very important things. I mentioned the opioid bill. I have been working in criminal justice reform, you know, across the aisle. I've worked on voting rights reform across the aisle. I've worked on the Adam Walsh bill, you know, which, you know, was you know, designed, you know, to let people know if there was a registered sex offender in their neighborhood across the aisle. And, you know, what I can say is, you know, I'm proud of this, this record. What frustrates me is the news media, which is your principal source of information as well as mine, you know, doesn't report on this kind of stuff. You know, they get their ratings increased, you know, by talking about conflict, controversy, real or imagined misconduct and the like, and they never cover anybody who is doing their job, you know, and working in a bipartisan manner and attempting to, you know, get some things that actually help improve the standard of living and the quality of life in the United States of America. But, you know, I've done that. You know, I will continue to do that. This is something that I've done, you know, all throughout my career in Congress. You know, I've worked with President Obama on a number of things. you know, including, you know, the bailout of Puerto Rico, so the taxpayers didn't have to end up picking up the tab. It would be the bondholders and their spendthrift politicians down there. That's law as well. And the Freedom Act, which ended up being, you know, passed on a bipartisan basis that got rid of the NSAs gobbling up everybody's phone records, that was my bill, and I started almost alone, except with Senator Leahy of Vermont. You know, everybody else, including President Obama, was against it, and it ended up being passed overwhelmingly and signed by Obama, and he gave me a phone call thanking me for my efforts, this Republican congressman. So that's my record, and I'm going to continue to run on that.
Sir, no, I appreciate that, and I appreciate your past record. And I actually, more what I was looking for was, I think we do hear a lot of divisiveness in the media, and we don't hear the positive. We only hear the Republicans are pushing through this bill, the Democrats are doing that. And I guess more what I was looking for is, looking forward, what things should we be watching for so that we can say, hey, look, my congressman is reaching across the aisle. And I think that's what I was looking for, is from a forward-looking perspective. What things should I be watching for so I can see that?
Well, you look at voting rights, you look at criminal justice reform, you know, you look at things like prisoner rehabilitation so they don't end up reoffending and going right back to prison and stuff like that. You know, now that isn't really a sexy hot button issue, but, and it isn't one where the Republicans and the Democrats go and face off against each other. But, you know, I'm there, and all that stuff can be found on the internet in one place or another. I have always attempted to treat my constituents in a respectful manner, regardless of whether or not some of them are respectful. And I'm going to continue to do that. And, you know, I think I, you know, run an office where I, you know, told all my employees to be respectful. If somebody's got, you know, a problem with the federal government, we don't ask them what their politics are. We get down the information and we try to fix it for them.
Thank you for your time.
Thank you. Anthony Steiner, North 81st Street.
Hello. Thank you. I want to thank you too for all the town meetings you've been holding. I think that's the absolutely right thing to do. I wonder why they're held in halls this small. I think that's one fix
Well,
we need to look into.
Can I answer that for you? First of all, I did have a meeting scheduled in March, and we got hit with a snowstorm. Everything was canceled around, so I canceled mine as well, and it was kind of slippery out there. My next 3 months newsletter, you know, was already at the printer, so the first meeting with the newsletter following that is the one that is here in tonight. We work very closely with the Capitol Police and local law enforcement on what is an appropriate venue on that, and this has been even more acute you know, since the assassination attempt on the Republican baseball team. You know, all you need to do is have somebody that's gone overboard because they spend too much time on the internet or watching cable TV news, and a tragedy can happen, which can impact people at the meeting. My staff has extensively researched venues, you know, throughout Tosa, and we cannot pay a rental fee for any of the rooms on that, and I think that public facilities are to be used for public meetings, you know, like this anyhow.
You can't use school auditoriums.
No,
or
you can't. School auditoriums can't be secured, you know, for law enforcement, and school auditoriums very frequently, you know, have school things that, you know, which obviously have got to take priority because it's the school's auditorium, not everybody else. You know, we did meet with the mayor of Tosa, you know, and talked about, you know, these problems, and you know, about the only place that we can hold a meeting that meets all of the requirements is here. We did ask about the Civic Center next door, but that closes at 4:30 every day and is closed on weekends, and they also charge a rental fee, so that ended up being out. And I think that's unfortunate because that seats 300 and this place seats 125, but if they don't open it up after 4:30, I like to have the meetings when people can come.
Okay, thank you on that.
Okay.
I have some questions on, you know, healthcare's been covered, but I have a little difference take on the question. I think the CBO's been highly respected in terms of assessing legislation and public policy. And their analysis of both healthcare bills, the House and the Senate, the GOP bills, has shown 20+ million people potentially losing their insurance. It's an estimate. If it's 10 million people, it's linked to issues that have already been brought up, the risk of death and serious health problems. Do you believe the CBO's analysis of the House bill is correct, and where do you disagree?
The CBO, has had a terrible record on estimating healthcare costs. They were way low in estimating Obamacare. They've been way low in estimating Medicaid, and things like that. They're pretty accurate on a lot of the other stuff, but the statistics will show that their accuracy is really not very good when they've been projecting out the cost of various types of healthcare programs.
So who do you rely on for accurate analysis on the legislation that was put out?
I guess it's a combination of stuff. I do an awful lot of reading, of treatises that are basically on both sides of the issue. And again, it's very hard to have anything in a black and white situation as we're dealing with healthcare. I've seen, projections that when the Obamacare exchanges collapse, and it's not if, in my opinion, but when you're going to have, over 25 million people end up losing their health insurance. Now, I can't say that that's any more or less accurate than what the CBO comes up with, but it's obvious that Obamacare is on a death spiral. We lost
you believe there's no way to address the failure of the exchanges outside of the legislation that's been proposed?
Well, I guess I'm frustrated, we have not gotten any Democratic support, not one member. Okay, stop. 5. Any Democratic support, not one member on the Democratic side of the aisle, who has been interested in fixing Obamacare.
I agree. I am frustrated by Democrats who have not come forward with a solution as an alternative, and I think that's where the bipartisan discussion needs to go.
But, they were asked at the beginning of this process, following the election when the Republicans, won the White House and both houses of Congress, to come in, and work to come up with a bipartisan solution. Pelosi and Schumer refused to do that. And I can say, going back to when Obamacare was originally passed, I was sitting in the House chamber and Obama had a joint session speech. He looked over on the Republican side of the aisle and said, I want your input. The next day I wrote him a 1.5-page letter on why we have to have medical liability reform. And I've yet to receive a response, and that was 8 years ago.
I'll say that about your staff. I've received responses to my emails.
Well, maybe some of my staff should have gone over there.
Yeah. And we don't agree on policy. I'm one of those Democrats in this district, but I respect your service and what you've done over the term of your office. Second question, we talked about the Russian cyber attacks. The president has been delusional in denying that there is a connection between the Russians and the cyber attacks on the most recent presidential election.
Well, I agree that that there is a connection, but
my question is,
okay,
what can we do now to protect the midterm elections from cyber attack, to restore confidence in our election system?
Okay, well,
right now, what can we do before?
The first thing that we ought to do, is to find out the nature of what happened in 2015 and 2016. It would be very helpful if the Democratic National Committee turned their server over to the FBI for a forensic analysis. That might answer that question and allow us to, deal with this issue, in a much more effective manner. And they haven't been doing that.
My impression is that the heads of intelligence agencies, the federal intelligence agencies, all agree and are very clear that there are the Russians interfered with our elections, and they're basing that on evidence that they've collected that is confidential that we don't know, there must be some things that,
Yeah.
bipartisan again, that Congress and even the president possibly can start working on to protect our elections.
Well, I can say that both the House and Senate Intelligence Committees, have been investigating this, recognizing that a lot of it is highly classified, how we're able to get any information. And they've had some public hearings, and they will issue reports when they're done on that. But, the point that I would like to make is that, assuming for the sake of argument that the Russians did all that they are alleged to have done, I have yet to find the first person who changed their vote from Hillary Clinton to Donald Trump because it would make Vladimir Putin happy. If there's anybody in this room that did that, please stand up and let us all know.
I'm sorry, but I find that
Yeah.
a bit
Based on
flippant.
faulty information.
And I believe that the sanctity of our democracy,
Hey.
Democratic Republic, is based on fair and open elections.
I agree
And
with
this
you.
is-
I agree with you on that,
This is an attack
sir.
on the United States.
Yeah, I agree with you on that, sir. Now, we had a recount of the presidential election in this
I'm not
state.
saying that this
Hey,
election.
may I answer it?
Sure.
We had a recount, and the state elections board and all of the county clerks around the state said that there was no indication whatsoever that any of the electronic systems that are used in some communities were tampered with in any way, shape, or form. And that's a matter of public record, and that was being looked at by the Green Party as well as by the Democrats and the Republicans at the time these recounts were being done last fall. So, I guess the question, that we have to ask ourselves is, show us the evidence. There's got to be some concrete evidence on how this affected the election. They might have tried, but way back to Soviet days, the Soviets were mucking around with our elections, and Putin mucked around with the French election, and I would expect he's mucking around with the German election, which is coming up in a couple months.
Okay, and my third point, I guess, gets to the question of leadership.
Mm-hmm.
And you've displayed significant passion about this issue. And getting at the evidence is what you're proposing. Show us the evidence. I am a bit dismayed, I'm very dismayed actually, and about the lack of, let me restate it. I'm dismayed that members of Congress on the Republican side have not stood up to the president when he basically makes statements about being in denial about the cyber attacks. I don't know why a member of Congress wouldn't see that as an opportunity to lead, to challenge the president on that, and to start working to resolve this issue.
The Republican members of the House Intelligence and Senate Intelligence Committees are already doing that. They have had public hearings, they have had private hearings.
I'm talking about rebutting the president's stance, which is basically denial and avoidance.
Well, wait till a report comes out, on that. They are investigating this, they will make a report. What I can say is, one of the things that I've learned in, my political career is don't open your mouth until you've got the facts straight. We don't know what the facts are. We have two committees that have subpoena power that are looking at the facts. Now, having said that, it's going to be much harder to get witnesses to appear before the committee without taking the Fifth Amendment because of the independent counsel's investigation. And that is a criminal investigation rather than a counterintelligence investigation. When you have a criminal investigation, the targets are all under the gun on whether, they have committed a crime or not. And they will be advised by their lawyers to take the Fifth Amendment. Now, the only way you get around somebody pleading the Fifth Amendment successfully is by giving the people you subpoena immunity. That would be a terrible mistake. And I bring you back to Iran-Contra of 30 years ago, where Oliver North and John Poindexter were given immunity. They testified, they were convicted in a criminal trial, The appeals court reversed those convictions because the Congress wanted to go public and give them immunity, and the prosecutor used immunized evidence in order to obtain the conviction. Now, I guess the question that all of us have to ask, is whether you want to have something that is on TV with people being given immunity and having them walk even if they have committed a crime because you don't have enough unimmunized testimony to obtain a conviction, or whether you want to let the criminal investigation go to work, let them plead the Fifth Amendment, and then if the jury of their peers decides that they're guilty, then they're guilty and they'll go to jail. I subscribe to the latter part rather than, having, a public spectacle, which was what Iran-Contra turned into, with immunity that meant that the two principal culprits, if you want to call them that, ended up walking because of what the prosecutor did with the immunized testimony.
I want the process to move forward like you
Okay.
do. And I want it to be the appropriate process. As
The
you
appropriate
described.
process is to let Mr. Mueller do his job.
But I think you're missing, the one point I'm trying to make here, you're missing a bit. I am distressed that when our president, who's the leader of your party, leader of our country, I'm not contesting that he was legitimately elected, denies connections and obfuscates about the issue, that our leaders do not stand up to our president and say, enough, we need to work on this and solve this issue and let the process move forward. No one takes a public position against the president.
If we want to have bipartisanship, that should be led by the Democratic leadership in Congress.
Congressman, I think if you stood up and voiced the opinion that the president should recognize the findings to date by our intelligence agencies, that the Russians meddled in our elections, and we need to move forward with the process, and he needs to accept that, that would be a major step forward.
Well, I am not privy to what the intelligence agencies have found, and if I were privy to that, I couldn't tell you because it's classified. The thing.
Right.
Yeah, and I respect that because having good intelligence and protecting the sources and methods keeps us safe and gives us an idea of what people who are trying to do bad things to us are up to.
Well, but the impression is that you and others who have not spoken up have hitched your trailer to the Trump train. You're
Sir, I've met the man once. That's all. I said I would support the nominee of my party in January of last year. I also said I wouldn't vote for Trump in the primary. Okay?
Thank you.
So now it's time to resist him as a fascist.
Yeah. Pamela Oren of North 95th Street. Pamela Oren. Pamela still here? Okay. Jeanette McRoberts, Wauwatosa Avenue. Jeanette here? Okay. Jennifer May, Milwaukee Avenue. Okay.
Thank you for calling on me. Congressman Sensenbrenner, you have championed the Voting Rights Act in the past, leading to the passage of its renewal in 1982 and in 2006. And you again supported the VRA after the Supreme Court struck down sections of the Voting Rights Act in 2013 in the case Shelby County versus Holder. You called for repairs to the gutted legislation and introduced a bipartisan bill with Democrat John Lewis of Georgia in the form of the Voting Rights Amendment Act, H.R. 885. Unfortunately, this bill didn't make it out of committee as far as I know, looking at what was online. This year, June 21st, Representative Terry Sewell of Alabama introduced H.R. 2978, the Voting Rights Advancement Act of 2017, which is also co-sponsored by John Lewis of Georgia. Would you support Representative Sewell's bill and help fully pass it into signed law?
No.
If not, when and what legislation will you support to ensure that all U.S. citizens are able to exercise their constitutional right to vote?
I am committed to fixing the Shelby County case. To do that will require a bipartisan response. Mr. Lewis and I have reintroduced the bill that we had in the last Congress. Things have gotten a little more complicated since the last Congress. We have an Attorney General who is not on our side. In the Obama administration, we had an Attorney General who is on our side. And the only way that I can get a bipartisan Voting Rights Act, passed is to go around the Justice Department, which means going to President Trump directly. So that might be one of the reasons why I want to antagonize him, because I have something that I think is much more important than having a 40-second soundbite.
Thank you, sir.
Chuck Wilcox, North 121st Street.
Thank you. Last year, after President Obama vetoed a Obamacare repeal bill that had strong Republican support, House Speaker Paul Ryan promised similar repeal if Republicans won the White House. Quote, "We have shown now that there is a clear path to repealing Obamacare without 60 votes in the Senate," end of quote, he declared. Quote, "So next year, if we're sending this bill to the Republican president, it will be signed into law." Sadly, he lied. The bill written by Speaker Ryan this year is nothing like the bill sent to President Obama last year. It fails to repeal many of the core parts of Obamacare and will lead to even higher premiums. Likewise, Senate Majority Leader Mitch McConnell, Republican of Kentucky, promised numerous times to repeal Obamacare, quote, "root and branch," end of quote. Sadly, he lied too. This bill leaves Obamacare's root, its trunk, and most of its branches. It even waters it with a brand of new entitlement programs. These leaders said Obamacare mandates could be repealed procedurally in the Senate. But we learned that not only is this untrue, they never even asked the parliamentarian about it. After this lie was exposed, they admitted that they don't actually want to repeal the mandates. This in turn exposed the lie that exposed the lie that they will repeal the mandates administratively in phase 2 of their plan. The lies never end. Paul Ryan and Mitch McConnell broke their word, failed the American people, and let down President Trump. It's why there are reports now that the president is disappointed with how the GOP leaders have handled this process. He should be disappointed. Now it's up to us conservatives to clean up the leadership's mess and deliver a victory for Americans. First, conservatives should defeat RyanCare, take it out back and shoot it because it can't be fixed. It's poorly constructed on many levels and is so unpopular that the best way forward is to start over. Second, conservatives should demand full Obamacare repeal, since that is what Republicans promised, and that is the only thing that will fix our health care system. If GOP leaders refuse, conservatives should begin insisting that repeal be part of other must-pass legislation. While some may want to walk away from the issue, conservatives won't do that. We truly oppose government-run health care and will never stop fighting against it. Lastly, one strategy is for Congress to move full Obamacare repeal and tax reform together under budget reconciliation. The revenue savings from full repeal could be used as an offset for significant tax cuts, and both could be passed as part of one bill with 51 votes in the Senate. And lastly, Republicans in Congress need to assess whether it's time for new leadership. Americans rejected the establishment this past election when they voted for President Trump. And the current leadership may not be willing or even capable of draining the swamp. As my representative, I want to thank you for working hard to advance the principles of freedom that make America great. Because of your efforts, we may succeed in stopping Obamacare from being forced on us for years to come, and stopping the putting a lipstick on Obamacare in the form of RyanCare or MitchCare.
Can I ask you a question?
Yes, sir.
If Paul Ryan is replaced as Speaker of the House, who do you think should be elected Speaker?
Oh, I believe me, we'll be looking into that when that becomes a possibility.
No, it's not me. I don't want to be Speaker. That's the
I
worst
didn't-
guy.
He didn't
I
either.
didn't suggest it. But he is an establishment Republican, just a rhino, a Republican in name.
No,
only.
he's not.
He was
No,
all for
he's
the
not.
TPP, and even you mentioned that when the TPP was put through, in one of the meetings here.
TPP was never
you mentioned
even
how
came up for a vote.
Excuse me, you mentioned that the TPP was put through. You, as a member of Congress, had to walk down a long hallway, you couldn't even bring a tablet and a piece of paper in to take notes or recorders. This is the same way Mitch McConnell has handled this health Mitch care. He's rolled it out where nobody knew what was in it. It's done behind closed doors. It too is a travesty of a Republican representative government.
Okay. Now, one of the things that all of us have learned from meetings like this is that the overwhelming majority of the American people want to protect themselves from losing coverage because of a pre-existing condition. If there's a straight Obamacare repeal, there's no protection against being denied coverage for pre-existing conditions. It would go right back to where it was.
I am admitting that if you repeal it, that's actually going to put the onus on Congress to actually do something to replace it with something worthwhile, or else let the free enterprise system take over. The insurance companies aren't going to let that money sit on the table. They're going to offer insurance.
I can say the same thing applies to annual and lifetime caps, and the same thing applies to having kids on the parents' policy up to age 26. There is overwhelming support in that. We have listened, we have responded, and the two major changes, or three major changes to a straight repeal, are those protections that are in there. Now, as I said earlier in the meeting, we recognize that that is going to, raise premiums because there will be more payouts as a result of these three things, which are gone. There would not be those kinds of payouts by insurance companies. And, that's why I went through this elaborate discussion on why we would separate the high-risk people out with a high-risk pool with the federal subsidy, and that would have a way of lowering the premiums for the low and medium-risk people. We keep them all in the same pool, which Obamacare did. That's one of the reasons why the premiums are so high, that we have 115,000 people in this state alone that paid the fine to the IRS because they thought that the premiums were unaffordable, and the deductibles and all of the other things. So, having said all of that, it's very complicated. I can say that I don't think there would be the votes today for a straight repeal of Obamacare like there was in the last Congress, which was the bill the president vetoed. Now with phase 2 and phase 3, that's as a result of decisions that were made by the Senate parliamentarian on what violated the Byrd Rule. And the Byrd Rule says that reconciliation bills have got to do two things. One is they cannot include any provision whatsoever that does not have a direct impact on federal finances. So things like getting rid of the antitrust exemption that insurance companies have, when the House passed the bill with my support on that, that doesn't have a direct impact on federal finances. Doing something on medical liability reform, crossing state lines for health insurance policies does not have a direct impact. That's why we've got to either pass separate legislation, or things that can be done administratively will be done administratively, but cannot be done administratively until the reconciliation bill, Ryan Care, Mitch Care, Republican Care, whatever you want to call it, is passed and signed into law. And nor can a tax reform bill end up coming up until that bill is passed and signed into law, as well. So, I guess what I can say is that, this is a complicated thing. It's, like having a 3,000-piece jigsaw puzzle. It took a long time for the Democrats to draft the ACA. It's taking a long time for us to get it right, too. but I'm just saying that the consequence of letting Obamacare stay the way it is, because Congress can't pass anything, is probably going to be more disastrous with more people left uninsured and, you know, a greater impact on the economy and on healthcare, you know, than trying to fix it.
Thankfully, the president is beginning to disagree that with the GOP that he's gone along with. He's calling for repeal.
Well, I could say that, you know, right after the House passed the health care bill, the president invited everybody up for a party. Now, I didn't go. I got on a plane to come back here to hold meetings like this, so I didn't go to his party. You know, then he turns around and calls the bill that he twisted arms in favor of and threw a party to celebrate me. Go figure.
One last point, and then I'll drop this at the moment. When at the beginning of the founding of this country, philosopher Alexander de Tocqueville came over to this country to see what made this country great. And after studying it for years, he came to a number of conclusions, one of which was, he said, this country will be great until they discover that they can vote largesse or money out of the public coffers. So basically what we've got is people that have decided, okay, it's a right to have health care. Then it's going to be a right to have housing. Everybody, the government pays for housing. Then they pay for everybody's food. Then they pay for it. There is no end if it's some kind of right.
Sounds like
Because a lot of people might want the free health care or the free whatever. Thank you very much.
That sounds like communism to me. That didn't work out very well, and Russia did it.
Sounds like justice.
No, it sure does.
Yeah. Lisa Gerbo, North 72nd Street.
I want to thank you for your voting record and for helping eliminate wasteful spending. I'm a Navy vet, so was my husband. My daughter is an Air Force vet, my son is an Army vet, and my brother is a Marine vet. I would like to know why the Veterans Choice Program restrictions have not been lifted so that all eligible veterans can go to the choice of medical centers, of private medical centers, and not have to go to the VA. Why is the government forcing veterans who fought for our freedoms not to have the freedom of where they get their medical care? Everyone else in government that government covers gets to go to private medical facilities, but veterans do not. We have lots of excellent hospitals in this area, including a lot of my neighbors work at them. At Freighter, there's a whole bunch of them right down the street. But veterans in Tosa don't get to go to them. They have to go to the VA. The Washington Times is reporting that President Trump is proposing a 6% increase to the VA for the 2018 budget. Why does the government keep throwing more and more money to the VA? Government-run healthcare monopolies are always bad, and competition by private sector is what increases quality. Please give all vets access to quality care and open the VCP to all eligible vets, no matter where they live. Thank you.
Let me say, I agree with everything you say, and I support unlimited vets choice. You know, what has happened with the Veterans Lobby and the Veterans Organization, they're all very well-meaning people, is that they look exclusively at the funding level and they don't look at the administration of how that money is being spent. That is a big mistake. The Congress has always given the VA medical enough money it needs to treat eligible veterans. If supplemental appropriation is necessary, it's passed. You know, there's now advanced funding so that if they run out in the last 2 months of the fiscal year, they can borrow against their next year's appropriation. But the veterans organizations have not been zeroing in on the administration of how the VA is run. We have been lucky here that both Zablocki and Middleton have been very well administered. When you see the disaster at places like Phoenix and the opioid.
They don't have a choice. I mean, even
Hey, let me finish, please. I agreed with you, okay? Yeah. They've got to look at the administration of this, and they are all opposed to Veterans Choice. So you have all of the Veterans Organization leadership, you know, coming out and saying Veterans Choice, you know, is a bad idea. I do not agree with that. on that. But I also think that the veterans organizations are gonna have to look, at the major administrative follow-ups in the system that they have. If veterans want to go to the VA, God bless them, we shouldn't keep them away from that. If veterans want to go to someplace else, God bless them too, and they ought to be able to go to that. But if they choose to go to the VA, they ought to be sure that the place they're going to is well administered, and there isn't fiddling around with appointment lists so that, people die because they got pushed back in the appointment queue, which has happened in Phoenix, or, people die because of opioid overdoses because the candy man in Toma was busy writing prescriptions. That's inexcusable, and that's oversight over administration. Not the money. Now, I think that, if you have veteran's choice, veteran goes to a private doctor, the private doctor submits the bill to the VA, just like if a Medicare eligible patient goes to a private doctor, the bill goes to Medicare. And, that seems to work reasonably well, not perfectly, but reasonably well, and I think that, there should be a similarity between the systems.
So will you introduce the bill?
Bill's already in and I support it.
Like I said, even illegal aliens, they get to go wherever they want. We spend the winter.
Well, that's a whole different issue. Anybody want to go there now?
No.
Okay.
I think everybody should have a choice, and all it does is make healthcare better. I mean, my neighbor works at the VA, and she's great. I'm not saying that it's bad, but there should be choices. And my son was saved because he didn't go to where he was supposed to go, the VA. He went to a private.
I'm sold.
It saved,
Yeah.
it saved his life.
Juliana Wesson, West Burleigh in Tosa.
All right, thanks. As I look around the world, and I've had a little more opportunity to travel in recent years, I see a lot of highly respected countries that have similarities to our country, the U.S. And I see them providing good quality health care to all of their citizens. And I see them managing that financially. I think that if we had the will here in Wisconsin and in the United States, we could gather different huge buckets of money from the VA, from Medicare, from Medicaid, from maybe being more diligent about looking at our tax base. We could gather those buckets of money, and we can, in a fiscally responsible way, provide health care for all of our citizens. My mom, who is 81, in northern Illinois, worries like you worry about the future generations. She worries about their health and welfare, the health and welfare of her grandchildren and her great-grandchildren. And she sees the struggles they have in those initial low-paying jobs to be able to afford health care, let alone quality health insurance. I think we have other opportunities to, in a very financially sound way, fund health care. We can greatly reduce or eliminate the insurance middleman. We can use large-scale bargaining power to reduce costs. We can use science-based data to implement quality control. We have the opportunity now to provide health care for everybody in this room, everybody in the United States.
Let me respond this way. Countries that have a universal government-run healthcare system have big financial problems. The election in the United Kingdom a month ago, the Labour Party made a lot of points and gained a lot of seats because of allegations that the Conservative government was not funding the National Health Service adequately. In Canada, the government puts a limit of about 9% of gross domestic product on how much they will spend on health care, and they will not exceed it. So, as a result, it's a pretty good basic health care program, but when you need some really specialized treatment, there are a lot of Canadians that cross the border and have it done here. And it's the limitations of what the government feels that it can do. Now, Canada spends about 9% of GDP on healthcare. We spend 18%. The simple way when you are seeing cost overruns is to simply have an across-the-board cap or an across-the-board cut or something like that, which is what the Canadian government has done for years and years and years. And, you know, if you come in with a gallbladder and appendicitis or delivering a baby or something like that, the Canadian healthcare system is great. You know, if you've got a very difficult cancer to treat or a diabetic condition or an infection or something like that, then the Canadian healthcare system is very, very sorely lacking, which is one of the reasons why, you know, a lot of hospitals on the border, like Buffalo or Seattle, end up doing very well because of Canadians coming across the border to get treated there rather than in their own country. Margaret Ward of North 121st Street.
Wow, I hit the jackpot. I've signed up many times. I've been to many of your meetings. They're very interesting. I thank you for having them. I appreciate your bipartisanship, which I've learned about since coming to your meetings, so that's a good thing. But I have a quick question. What happens to the fines that people pay to the IRS for not having Obamacare?
Goes into the, I can't specifically answer that. It either goes into the general fund like the income taxes that are paid, or there is a special fine and forfeiture fund that the Justice Department administered, and it's used to pay judgments that are levied against the U.S. government. And there have been some other uses of that, where fines and forfeitures, particularly some of the really big ones that banks and financial institutions have had to pay, have been used to finance nonprofits and things like that. I don't agree with it being used to finance anything, except a money judgment that a court has entered against the United States government.
Okay, that's good. I was wondering what happened to that, because it must be a lot of money coming from a lot of people, and too bad that can't go into paying for the ACA. One other thing I wanted to mention is that I noticed that you were ticking off when people would moan and groan, you were ticking off, and maybe considering that if it got bad, you would suspend the meeting. I worked in the school system, so I had to control children. But I always told them at the very beginning what I was going to do. And I was at the meeting in West Allis this spring that was very abruptly ended. And I kind of think it might be a good idea if you tell everybody at the beginning, I'm going to keep tabs on you, and every time I find that you are disruptive, I will make a tick, and when I get to number 5, that's it. Or number 17 if you feel no. But really, I do think that might be a good thing, because there were many people who were extremely frustrated at that West Allis meeting. And I understand, I know you were, I know you were. And you could have easily gotten very upset here. Thank you, most of you Wauwatosa people, for remaining calm. Because people are, as we all know, very so I think it would behoove you to let the people know ahead of time, really and truly, what you're going to do. Because people can't help go, oh, and I know you and you don't even like clapping. I understand that, but I would appreciate it if you would just do it a little bit different.
Number 6, I've been keeping track.
How far did you go?
That depends. What happened in West Allis is I was asked a question, and I started to answer that, and the room erupted. So I banged the gavel, and I said, this better not happen again, and I started answering the question the same way, and the room erupted. And I don't think I had any other choice but to adjourn the meeting at that point in time. What I read at the beginning of the meeting is that, we can disagree without being disagreeable. And a lot of it depends upon the intensity and, whether anybody who happens to take a view opposite to the majority of the room ends up getting booed and sometimes being intimidated on that. And that's, not the way Americans are supposed to debate issues. They're supposed to debate issues on the merits, and we're supposed to be respectful, and we recognize that there are good arguments on both sides of the issue, which is why it's controversial. Now, I'm going to call on one more person, then we get to 8:20. The second part of the meeting will be devoted to those of you who have got individual problems with government agencies, not a continuation of this discussion, so I can get this information down and start to help them out. Our contract with the library requires that this room be vacated by 8:40. That means everybody out by 8:40. Otherwise, we can't come back here, and I'll have to invite Tosa people to come to neighboring communities. I want to have meetings in Tosa. So with that being said, the last one up is it Matt Levesque, Pleasant View Street in Wauwatosa?
Yeah, very good on the last name, by the way.
Well, good, I'm doing better than previously.
Yeah, fantastic. No, it's admirable. I'd like to echo some of the other comments here. Thank you for continuing to have these town halls at a time when many of your congressional peers are not. I spoke to my mother this afternoon, her congressman in Minnesota opted out of many planned July 4th weekend events to meet his constituents, presumably sensibly over this bill. I want to share with you a little bit of my background. I've been a licensed life and health insurance agent here in the state of Wisconsin for the better part of the last decade. I've worked for two major insurance companies in a variety of analytic and health and economics roles. I have been involved in those industries through the implementation of every major legislative act since the law started, since mental health care. So when I speak to you about health care reform from the payer side, I am not speaking as a layman, and I'd like both of you in the room to understand that.
Can you speak louder?
I'm sorry. Oh, okay. Any better? Yeah. Sorry. So, just again to recap, I spent the last 10 years of my career in healthcare economics. I'm very familiar with how medical cost works, the costs that come in the system. I wish these people weren't changed. I feel like they're going to talk about more. I've heard you say a few things tonight that were not initially what I came here to talk or ask questions about. First of all, you brought up the death panels. That was PolitiFact's live year in 2009. That's been repeatedly refuted. What the ACA death panel legislation was actually allowing Medicare to reimburse providers to have appointments with their patients to discuss end-of-life and living will situations. That's all it was. It was supported by the AARP. We can talk about that more. Secondly, you mentioned that, and you can go ahead and correct me on this one if I heard you wrong, but you said that since Obamacare was implemented in 2009, premiums in Wisconsin have gone up 97%. Is that what you said?
Obamacare was implemented in 2014.
Legislation went into effect in 2009.
No, it did not. It wasn't even passed till 2010. It was
Go
passed
ahead,
in March of 2010, signed by the president. Then it was introduced and passed by the House in 2009, but not enacted until 2010, and it didn't become effective in 2014.
Okay, let's say 2014. Let's use your number. Okay. That would be an annualized trend over the last 3 years of approximately 33%. Is that accurate? Doing that? Okay. When I entered the market here in Wisconsin, our average trend for a renewal in the employer market, large group and small group, was 33%. So using your number, we're not seeing any premium increase. Finally, then I'd like to talk about the death spiral thing and ask, this is where my actual question comes in. In what way, elaborate, are we actually talking about a death spiral? Is it the record low numbers of uninsured? Is it the high correlation between the low uninsurance rate and people being able to see doctors without fear of cost? Is it the 50% reduction in uncompensated medical care in hospital systems? Is it the 2.2% reduction in the private market? These are all numbers, by the way, from the Council for Economic Activities, not the CBO, which you stated earlier. Sorry, I didn't mean you stated unequivocally that you disagreed with the CBO estimate, so I'm not using those numbers. So how are those indicative of it?
Well, what's happening is that you're seeing people who are low risk and medium risk people dropping out of buying insurance and electing to pay the fine.
Sure.
And the fine is a lot less than the total out-of-pocket cost of premiums plus deductibles. So, people who are probably younger, definitely healthier than people who are older on average, because insurance actuaries are averages, they're not in the pool of insurance because insurance is a risk-sharing operation. And you have to have low-risk and medium-risk people to pay the benefits of the high-risk people. And if there are fewer and fewer low and medium-risk people, in the pool, and more high-risk people, that's what causes the death spiral, because the premiums for the high-risk people have to go up, and then they can't afford it anymore either, and then we have no insurance available whatsoever. That's the concern that we have, and I also disagree with you, sir, about the Independent Payment Advisory Board. They can decide, to terminate the treatment for people that don't meet certain criteria. And if that's the case, excuse me, if that is the case, then the patient and their family can still get treatment, but they've got to pay a private doctor the sticker price, which on these exclamations of benefits that we get is always much higher, than the price that the insurance companies have negotiated. And with that, I have to adjourn the meeting because we've got 15 minutes. We've got to get out of here.
Jim, I just have to say hello. Thank you for all your
Thank you. Only those who got it
Huh? He's pretty good. Learn anything? He's good at what he does. I mean, I disagree. So, he knows his stuff. Yeah.